Hello and welcome to S.T.A.R Productions, Spiritually Trained and Renewed Productions. I'm S.T.A.R, your host. Today I have with me a special guest. You're not going to want to miss this. If you've ever wanted to learn about the addiction field, revenue cycle management, insurance, I have an expert in the studio with me today, and you are going to love this. Stay tuned. Hi, and welcome back to S.T.A.R Productions, Spiritually Trained and Renewed Productions. It's not enough to be talented, you have to be spiritually trained and renewed. As you can see on my left, I have a distinguished guest with me. This is Johana Désir. Welcome, Johana.
Thank you. Thank you for having me. I'm excited to be here.
We're very excited to have you. So a lot of people don't know who you are. If you would just give them a brief idea, who is this guest sitting in front of me? Who's Johana?
Well, as stated before, my name is Johana Désir. I am a consultant. I am a revenue management consultant, to be exact, in the healthcare field, and particularly in the substance abuse and mental health field. So my background for the past 8 years have been perfecting my skills and my craft and understanding addiction, behavioral health, and along with what and how they get paid for clients who go into treatment.
Fantastic, fantastic. If you would tell us, first of all, how did you get started in this business?
Well, it was happenstance, really. I've always been in the healthcare field, and I just kind of fell into, in 2009, entered an ad for an opportunity working for one of the largest behavioral health provider in the nation, and I got hired.
Fantastic. If you would tell us, what is revenue cycle management?
Boiled down simply, revenue cycle management is the finance of a healthcare program, whether that's inpatient, outpatient. It has to do with the operation of getting money in from different payer source that can include the insurance companies, the clients themselves, their family members, or other source that pays a provider for services that's rendered. So that's, in a nutshell, what revenue cycle management is.
Fantastic. And as a consultant, what is it that you do in the revenue cycle management business?
In a nutshell, I help the providers get their money right. I educate them on processes that they have to implement. I educate them on systems that they need to use. I also educate them on state laws, regulation, and other governing bodies that govern how providers should render care to clients. What are the laws, what are the regulation, and whether or not the providers giving the services are meeting the requirements.
And the name of the company is JDésir Consulting, isn't
Correct.
it? JDésir Consulting, I understand that you have been in many states with your business. Could you mention a few of the states that you've operated in business already?
Absolutely. I started working for myself as a consultant in the fall of 2015. So it's been 2 years since I've been doing this on my own, but about 9 years working in the field. Because I am nationwide, really, I have had clients in California, I have had clients in Florida, I have had clients in Louisiana, in Tennessee. I've had clients, in multiple states to help them understand what is wrong, if anything's wrong with their practice, and how to, fix what's broken, particularly related to revenue cycle.
Awesome, awesome. I have had the privilege to follow you in a few of your ventures around town as JDésir Consulting, and that's been quite uplifting. Could you tell us, how did you get into the business? What happened that caused you to become today one of the most successful revenue cycle management consultant in the United States?
Um, it wasn't so much a calling. It's just doing it right. When you study how to do it right, you just want to ensure that whether it's for yourself that you work or whether you work with a company, you want to ensure that they're doing the processes that gets their money right. You want to make sure their money's coming in, it's going to stay in. There's a lot of variation with insurance. There's a lot of guidelines. There's a lot of rules. And it's oftentimes up to the providers to know what those are in order for them to, guarantee that the money that they're getting in is coming in and staying in. And so it's just something that I picked up that I happen to be really good at, and that just stimulates my mind, and I understand it, and I just want to go and educate people on that process.
All right. So, what happened in 2015 that actually got you into this business?
I was working for a company, a very large, well-known company here in Tennessee, and right around the 3-year mark, things just started changing, and I started voicing some concerns with some practices that was happening with regards to reimbursement. Again, as I stated before, when you know what the rules are, what the guidelines are for the different reimbursement methodologies, you want to ensure that your staff and you and the people around you are practicing within that guideline. And so when I started voicing some of my concerns and realizing that they were falling on deaf ear, there was just a lack of meeting of the minds with what the practices should be. And apparently asking certain questions just got me, let go, because it was, the concern was not about doing it right. The concern was just about doing it. And so when that happened, God just made a way for me to be able to practice on my own and be able to have a voice and be able to say, if we're going to do this right, if we're going to do this, we're going to do it right. And this is how to do it right. And so what was meant to be a hard time or a difficult season turned out to be a blessing, and where I was able to have some impact on a few programs, as I stayed in those states earlier, and was able to guide and coach and lead into the right way of running a revenue cycle program, and particularly in the field of addiction, but altogether impacting the healthcare practices.
How would you advise somebody who may be struggling, somebody who got let go from their job right now, somebody who's very discouraged because they thought that their job was forever, and they got let go and they're quite not sure what's gonna happen? How would you encourage them right now, just by looking at this camera number 2, and tell them about your experience and how you got through it?
Well, first things first, unless it is your own company, there's no guarantees in any job unless it is your own company. So don't go into any job thinking this is lifetime. That's, back in the 1950s with our parents or grandparents. In this day and age that we're living in, unless it is your own personal company and you have blood, sweat, and tears, there's never a guarantee. But if you do find the right organization that your passion, your heart is in line with their vision, their mission, and values, then there is good synergy, and you do have opportunities to influence change, and staying innovative. But if those things are not matching, where your sense of belonging it just doesn't fit, then absolutely go with your heart with where you want to be, because you do spend 8 hours. Sometimes, when I worked, I spent up to 10 hours. I traveled a lot for the company I worked for. I put in a lot of hours off the clock, and so I thought there was an investment there and it would have been mutual. But when at the core of who I am, doing it right again mattered. I hear all the time, do the right thing even if no one is looking. I carry that with me. And if you're in a situation where you feel where that morality and integrity is being questioned and you're having to operate in the gray area often, then either you make a decision it's not the right environment for you, or if the decision is made for you, then trust the process, trust your gut, and trust that there's a bigger purpose for your life. Reevaluate the kind of company you want to go into. If you don't want to go work for yourself, if you want to go work for another company, just ensure that your passion, your values, and theirs have a good balance before you jump into anything. But definitely trust your gut and trust your instincts.
Wow, that's great. Could you tell us, how is JDésir Consulting helping people out there? I understand that you help both individuals and companies. Could you elaborate on how you help both individuals and companies at the same time?
Sure. I am a little bit of a unicorn in this field to say that I do help both sides of the fence, the providers, the hospitals, the rehab places, but I also empower the families, the clients, to understand what their healthcare is all about, to understand when they're going in for surgery, when they're going to see the doctor, when they're putting their loved ones in treatment. What should they expect, both from the provider, from the insurance companies? And so because of that, I educate people on understanding their policies. I know insurance in general can be very intimidating. All those policies, all those word and languaging is meant to confuse the average consumer. That is just how they write those policies. So because I've spent the past 17 years of my career reading policies, understanding the difference between a deductible and a copay and out of pocket, and which one I should pay first and which one should be billed, I do educate friends, clients. I also help people when they're purchasing insurance, especially during this time with open enrollment. I help people understand what policies they're buying, why they should buy this particular policy versus this one, especially if they go see the doctor often, why they should buy a low deductible policy versus a high deductible policy, what does the copays mean, what does essential health benefit means, even people when they're going through open enrollment with their job. I have my friends call me all the time and they say, oh gosh, open enrollment is coming and we're switching from United Healthcare to Blue Cross Blue Shield. Which policy should I buy? Should I go with the HSA, or what is an HSA? What's a FSA? What's the difference between the two? So I also am very passionate about educating the average consumer about healthcare, about their insurance, so they can take charge of their healthcare if they're going to the doctor, to the hospital, so they can know what's being billed, why, and how does the process happen.
Fantastic. And you mentioned, this is open season.
Yes.
And if somebody were to watch this broadcast right now during open season, what would be the best way for them to contact you? Is it through your Outlook email?
I have a Facebook page, JDésir Behavioral Health Consulting. I do have an email. I do have an Outlook email. It is my first name, Johana.Désir @outlook.com. People can contact me via there and I will answer their emails. But yes, this is the open enrollment season where everyone has the option to either go on the ACA website to purchase a policy or through their job. Open enrollment through the ACA, I believe, goes through December 15th. And most job open enrollment ends, I believe, most employer open enrollment ends, I believe, at the end of this month. So I am available to help give counsel, guidance, advice.
And they can go on JDésir Consulting's Facebook page as well and contact you that way.
They can send messages and we're very responsive when people send messages through our Facebook page.
Fantastic. And now let's talk about the second way you help people out there. Not only do you help individuals, you also help companies. Could you break down how a company who's in trouble right now, needing your help, could you break down how you've been helping companies in the past?
Well, if a company is contacting me, it means they're either on their way to some trouble or they're already in the middle of trouble. So it's a good thing and a bad thing. It's because they're calling because there's some trouble or there's some issue. Typically, most companies call me when an audit comes about, when the insurance company either audits their medical records for accuracy or audits their billing practices, just to ensure that things were billed properly. They also can reach me via my Facebook page as well. They can email me. I have a very heavy presence on LinkedIn as well for my professional side for clients, facilities. They can find me on LinkedIn, just search my name, Johana Désir. But again, whenever someone reaches out, it's either they're about to be in trouble or they're already in trouble. I'd love for someone to reach out to me just to audit, to ensure before they get in trouble and put some mechanism in place before they get there. Because the thing that happens with facilities is when one insurance, let's say for example, Aetna audits a program, the thing most facilities or most hospitals or most practices don't know is the insurance companies talk to each other. And so if Aetna sends an audit, and they audit 20 of your charts, and then anything comes up that's red flag, they communicate with United Healthcare that, hey, they just audited this medical practice and there were some red flags. You may want to do the same thing. And so then they audit you, and then it becomes a cascade roller, of, okay, all of them are auditing you. So you definitely want to be proactive with your audit. Have a lot of internal audit process. That's where I help a lot with the practices that I've worked with, is help them set up a quality assurance department where they have their own internal audits, spot audit, chart audits, before it gets to the insurance. So the facilities can reach out to me as well via my Facebook page or my LinkedIn page.
Fantastic. I understand that a lot of people are looking at what you do and the freedom that you have doing it and the success that you've had, but they don't understand the ins and outs of an entrepreneurial woman, an entrepreneur. The fact that you work more hours than the regular 9 to 5, the fact that you wake up early in the morning and late to bed at night, and that you work weekends sometimes because you got to finish things. Could you talk to the entrepreneur right now who has a spirit of entrepreneur and they want to start a business? They're very excited, but they're not aware of all the ups and downs that's in ahead of time. Could you break down for us what that life looks like so that they can be educated that way?
Sure. Well, in anything, hard work is you have to know that you're going to put in some hard work. And when you work for yourself, and I can only speak to the healthcare field, because things are constantly changing, you have to stay abreast of everything that's happening, because that's how you make yourself valuable to your clients. So I am on the SAMHSA website, I am on the AMA website, I am on the ASAM website. I'm constantly educating myself, or I am attending conferences, I am attending webinars to know what's changing. Every year something is different with healthcare. Every year something is different with billing practices. Every year something is different with how you render care. What's new programs that are out there? What new guidelines the state, the federal government, the insurance companies are coming out with. So you could work for a client 9 to 5, but when at 5 o'clock you get home, you are now reviewing everything you did for the client if you go on site. You are now making sure that your ideas are very clearly articulated on paper, or if you're doing a presentation, you're reviewing your PowerPoints, you're ensuring that your facts are actually facts, you're giving them access to different websites, and so you want to make sure they know how to go on those websites. You are preparing training materials for their staff. You're doing a lot behind the scenes that demand a lot of your time, and in particular if you're traveling like I was, 2015, 2016, and even up till midsummer of 2017, you are educating yourself in the different states. There's a different on how a program runs in California versus how a program runs in Louisiana. So everything you know about Louisiana and how their regulation practices are is different than what is happening in California. And so you can't bring the data or the information from Louisiana to California because it's different. There's a difference. I've had clients tell me, why does this program don't have to do X, Y, and Z, wherein we have to do X, Y, and Z. Well, it depends on how you were licensed. It depends on the kind of clients you're seeing. There's a difference between an adolescent program and an adult program. There's a difference between a gender-specific women program versus a men program. So there are so many different things you have to keep ahead of. I attended a lot of conferences. I attended a lot of webinars. I not only attended conferences and webinars being given by the facilities, because there's a lot of program out there who do CEU conferences where you can earn CEU, but I also attend a lot of conferences given by the insurance companies, given by tech companies who affiliate with the insurance companies. Last spring I attended a conference given with Salesforce, was partnering with the insurance companies. I attended that on the tech side. I attend a lot of webinars given by Optum Behavioral Health, and some of those are paid and some of those are free. And so you do a lot of work to educate yourself, to add value to yourself, because you're essentially selling your knowledge to your client. That is what they're paying you for. You are the product. And so as the product, you have to stay innovative, you have to stay current, you have to stay aware of laws and changes that affects your client, because that's what they're paying you for. They're paying you to be their eyes and ears in a market because they're busy taking care of the clients. They're busy taking care of their patients. And so I've put in 80-hour work week, and I've put packages together on Saturday evenings. I've put final touches on my presentation on Sunday nights before I deliver them on a Monday morning to a client. And so it's a lot of hard work, but it's so rewarding, because you're doing something, and at the end of it, you could see your imprint throughout the entire process, and to know you had a little bit to do with that program's success. When you hire the right employee, the right billing staff, the right utilization management staff for your client, and they find the right candidate, it's immediate reward that I had something to do with that. So it's hard work, but it's, you get the reward to know that I was part of something like that, and all the hard work is worth it at the end.
Nice. 2 final questions for you. I know you're a busy woman, you get places to go and people to see. I understand that from the time that JDésir Consulting has been open to now, you've added values to the company. There are new things that you have added to make the company more marketable. Could you talk a little bit about the new things that you're offering as a company?
I mentioned earlier that I work with tech companies. Healthcare IT is huge right now. So one of the things one of the services that I provide in my consulting is helping a program walk through implementing their electronic medical record or their electronic health record. And most facilities, most doctors, most physicians are very hesitant with EHRs and EMRs. They prefer the old method of paper chart. But because of some of the healthcare laws, it is mandated that they move towards electronic health record. It's safer, it's more accurate, it's more efficient. And so walking an entire program, sometimes 80 users, and sometimes the program is 50 bed, walking 80 users in different areas and different skills and different specialties and implementing an EHR is a huge, huge challenge. And so one of the values that I have added is I am partnering with a couple of EHRs where I can serve as a consultant for them by being the prerequisite to implementation. So what I go in is I'll go into the facility on behalf of the EHR and I'll evaluate their workflow process, and I'll see where there is some holes that needs to be plugged in. I'll kind of lay a foundation and get everybody accustomed to efficiency with EHR and get everybody, to breathe a little, to let them know it's not all bad. We're gonna cross this together. And then I mostly focus on workflow process, because when you go in, even when I go into my own consulting practice and I tell, the front end staff, I was like, okay, tell me your process. What do you do every day that is consistent? What do you do every day that if I come in, I could look at your playbook And without knowing a lot about you, I can follow the playbook and get the same result you would get. And about 8 out of 10 times, they don't have a playbook. They don't have a process. They don't know. So if somebody, I remember, and I learned this from my boss at my previous job, he would always say, okay, Johana, what happens, God forbid, if you walk out of the street and you get hit by a bus? Can your team function without you there? And if the answer is no, then you failed as a manager. And so I carry that with me in my practice, and I tell everyone that I meet, and the executive and the medical providers, I say, if you're not here and something were to happen, can your staff go on without you? And 8 out of 10 times the answer is no. And so that's when I walk them through writing a process, writing it down. I'm very process driven, because you leave less room for error, especially when you're dealing with medical acute clients, and you empower your staff to know that I can always go back to the manual. When we buy electronic, we buy iPhones or we buy TVs or whatever the latest gadget, there's a manual. Before you pick up the phone and call IT, there's a manual, and they always ask you, did you go reference the manual? So it's the same thing with healthcare management. You've got to create a workflow. So what I do for the EHR, I am the prerequisite before their team, their tech team, come down, and I work with both from the tech guys coming in and from the facility that's about to use this EHR. So I will be playing the bridge between the two to ensure a smoother implementation process, a more clearer understanding of what the facility needs and what the EHR company needs. So hopefully this is a new partnership that we're rolling out in the next few weeks, and hopefully we can get more on board next year in 2018.
Nice. Okay, final question. Sure. You have a little Johana who is looking at you right now. You have gone from entry level to management. You have been VP of companies. You are now the CEO of your own company, and you have the little girl, the little boy right now who for some reason has the same mindset as you. They understand this business really well. Like you said, you are a unicorn, so there's going to be a few of you out there, and they don't know how to get started. They kind of like this whole revenue cycle management, insurance, addiction field, and they don't even know how to get started. What would be your last advice to the little Johana or the Joan or the John looking at you right now, and you inspire them to move into that field of work? How do they go from A to B to C in a few minutes?
Well, I perfected my revenue cycle management skill in the addiction world, but revenue cycle management is something that transcends it's healthcare. It's healthcare. It's just my specialty happens to be addiction. But I've done revenue cycle for ENT, I've done revenue cycle for plastic surgery, and I've done revenue cycle for vascular surgery. So revenue cycle by itself, if that is something that someone is interested in the past, most people I know who fall into it, they have either started as a billing person, billing specialist, intake specialist, utilization management specialist. They usually start there in their entry level, and usually there's a hunger to know more. Like, why is this not getting paid? Or why did they pay that versus this? And so people usually get their billing certificate, their coding certificate, and then they just gradually move up the ladder, which is what I did way back when I was a medical billing specialist. And then I added coding specialist to that. And then I just gradually moved on to wanting to understand the entire circle. It's actually a whole circle. There's a chart, it's an entire circle, and so I wanted to know how all the pieces fit with each other. I just happen to do it in behavioral health, but there are people who are doing it in hospital setting. There are people who are doing it in skilled nursing facilities. There are people who are doing it in inpatient setting, DME, durable medical equipment, medical devices sphere. So my advice is to understand revenue cycle management process. Understand the rules and regulation, understand the workflow, understand the different roles and responsibilities within revenue cycle management, understand how one is dependent on the other, because you can't skip you can't do step 1, skip 2 and 3 and think you're going to get step 5. It doesn't happen. You won't get the return, the revenue, if you don't dot all the I's and cross all the T's. And so you've got to understand the entire process. And so whether that's, internships, whether there's a lot of coding, medical billing schools, there's a lot of healthcare management website where you can become specialized in that. And then whatever specialty you happen to be in, whether that's in inpatient hospital, vascular surgery, durable medical equipment, skilled nursing facility, or me, that was in behavioral health, you just then add that specialty as a extra on top of it. And so I've become addiction treatment services business operation, because that's just where the past 8 years has been. But revenue cycle in itself is a very intriguing space. It's not going anywhere because healthcare is not going anywhere. And with the complication with, insurance coverage right now, healthcare coverage right now with the Affordable Care Act, is it gonna stay? Is it gonna go? Because it affects the political realm. So revenue cycle space is not going anywhere. So there's job security there a little bit, but make yourself an expert at knowing the rules, at knowing the policies, at understanding the policies. At what level do they apply? I think that's what has worked for me, is that I made myself valuable in knowing the rules of the payers and knowing what makes the payers tick. And when you do that, you do become marketable, because the provider, the hospital, the skilled nursing facility wants to get paid. And if you are the answer to how they get paid, then you will be marketable.
Fantastic. That reminds me of Dr. Bernard when he said the difference between getting paid $10 an hour and $10,000 an hour is value.
Correct.
And you've added value. Well, that's fantastic. Before we close, tell us again how to reach you so that we can make sure we get some help from JDésir Consulting.
Sure. The quickest way for any programs out there, skilled nursing rehab, addiction facilities, small or big, the quickest way is my LinkedIn profile. Again, that's Johana Désir. That's my LinkedIn profile.
Spell Désir?
Désir.
Okay.
Johana is with one N, Johana. And for any program as well, who would like to just ask question or reach out to me, or an individual who have question about their health care, the difference between a deductible copay, my Facebook page is quick and easy that I can answer that, and that's JDésir Behavioral Health. You search that in Facebook search, and I will come up, and you will find it. It is a public page, and we are very quick to answer anyone's questions. So those are the two ways that it is the quickest to find me.
Great. And this is it. Can they afford you?
Well, I'm negotiable. Depending on the scope of work, I can be negotiable.
This is Max with S.T.A.R Productions, Spiritually Trained and Renewed Productions. My guest today is Johana Désir, the CEO of JDésir Consulting, consultant extraordinaire for revenue cycle management, addiction, and even those of you out there who just want to look at open enrollment to see what's going on for you and how can you get the best for you and your family. I want to thank you for being here with me, Johana, and it's always a pleasure to see you. I'm sure I'll be seeing you soon.
Sure.
And when JDésir Consulting goes to the next level, I want you to come back, join us, and tell us, what are you up to next?
You will be the first to know.
Thank you. All right, till next time, you'll have a blessed day. Thank you for following S.T.A.R Productions.